right, welcome back to this segment of Bayou Time. As promised, the parish president of Lafourche Parish, Mr. Archie Chaisson. Archie, welcome aboard. Good to see you.
Hey, Martin, how are you?
Good. I want to talk about the COVID and the Delta variant because it seems to me, in speaking with parish presidents, doctors, and I want to make sure that I ask this to everybody because it seems to be the norm at this point. It seems like the Delta variant, now depending on whether you have a vaccine or not, seems to be more cold related if you have the vaccine, a little more problematic if you don't. And are you getting the same reports on your end?
Yeah, Martin, I met with all three of our hospital CEOs this morning to talk about the status of their hospitals, their staffing, their bed count, things like that, ways that we could improve the narrative with the vaccine. And one of the things we talked about was the Delta variant, how contagious it is, and how the side effects are a lot different. We've seen through people who have been vaccinated that a lot of them who are vaccinated and have tested positive for COVID, whether it's the Delta variant or not, very mild symptoms. A few of them that I talked to when they were on their 10-day quarantine actually pressure washed their house, did a lot of stuff outside, kind of went on with very minimal symptoms. And even some of the people who aren't vaccinated, we've seen loss of taste, all the things that we've talked about with COVID throughout. And you do have that population that gets hit pretty hard, and unfortunately, we've seen some deaths because of it. And one of the questions I asked this morning was, hey, how do we know it's the Delta variant? Have we got a different test, than the old PCR test that we've been using for months now? And the answer was no, that, it's basically science study based, that, out of the total population of people who have tested positive, they're assuming that a majority of the population is the Delta variant because of the way they're looking at it. So, we still are in kind of a fourth surge, as we've heard the governor talk about it, as we've talked about it over the last several weeks. We've seen those increased case counts. We've seen an increase in hospitalizations. And I can't stress enough how important it is that people get vaccinated. That's the one easy way that we're going to be able to control this.
Let me ask you this, because last week you were pretty adamant about a report that came out from the CDC about ICU or CCU and about the number of people that were in there. It was, in your opinion, was sort of misleading. I'm going to give you a chance to say that to the public on HTV too.
Yeah, Martin, the one thing that we've struggled with throughout this whole pandemic has been the lack of trust from the public in the government and the numbers that have been put out, whether we're talking about total number of cases, whether we're talking about where those cases are from. You and I spent a lot of time during the height of it talking about how some of those case counts were actually wrong. They were in different parishes and things like that. So the news report came out yesterday, and the headline read that COVID surge fills ICU beds. Our phones, of course, began to ring here at the parish because people were concerned. So the first thing we did was we reached out to Dr. Riggins, who was quoted in the article as saying that, and said, all right, how many of these beds are filled with COVID versus other ailments? And he couldn't tell us. He was speaking in more general terms, so we reached out, went through the process with different officials, till we finally got the correct data. And out of those 30 staff beds at that point in time, only 15 of them were COVID, 15 were other ailments, heart attacks, strokes, things like that. In the grand scheme of things, the fact that all of our hospital beds are full is a bad thing. But what we were trying to do as government, and one thing that you and I have tried to do since the beginning of this, is to be as transparent as possible as we can with the data. And I felt incumbent upon me that we had to get that message out that, hey, look, it's not completely COVID, that the headline was a little bit misleading. And I've talked to the editor of the paper about how that was put out, and we had a long discussion about that. But, I'm not downplaying the fact that we are in a surge. I'm not downplaying the fact that our healthcare providers are busting their butts every day to be able to treat these things. But it was one of those things where we had to clarify that misinformation. And I took a beating for it, not only in the healthcare community, but by some members of the public who didn't think that it was the right thing to say. But at the end of the day, we had to be as transparent as we could. And one of the reasons we met with the hospital CEOs this morning was to really talk about that capacity, how they were seeing things, what their nurses and doctors were seeing on the ground level. And I think we came away all better for it. They understood in a better way what my position was from a transparency standpoint. I got a better understanding of the difference between the data we get from the state about the number of hospital beds available versus what is actually on the ground in the hospitals. And we talked again about ways that we could do a better job at talking about the vaccine and talking about the pandemic in a way that we touch the people who may be anti-government or anti-vaxxers, or just tired of the whole thing. We're tired of wearing masks, that are tired of hearing about it. And just really, how do we get that point across that, again, the best thing we can do right now is to go ahead and get vaccinated, and talked about the science and technology behind it. And you and I talked about that before. We're in the 21st century. The science we have now is better than when they developed the measles and the polio and the chickenpox vaccines, all this stuff years ago that our parents and our grandparents took without care, right? It was the best thing to do because we were in the middle of a pandemic. We're trying to relate those stories of old to today. And whether we're talking why we got it personally, whether in my case, because I wanted to visit my 80-year-old grandmother on Sunday afternoons for lunch, or whether or not you took it for your own various reasons to protect a loved one who may have an immunodeficiency or something like that at home, or maybe a cancer patient or whatever. But it's those little things that we're trying to get across to the public to help us get through this.
Well, look, I appreciate you joining us. I know you're busy. We're going to start getting daily updates from you all again, because the numbers are moving, and we got about 30 seconds left, and I'll just state y'all at 17.5, but just a nod will do. But I know we're all looking for herd immunity, right?
No doubt. We're all looking for something better than what we have right now, believe me.
All right, there you have it. The parish president of Lafourche Parish, Mr. Archie Chaisson. Appreciate his transparency and coming across. And we'll take a break here on Bayou Time. We'll have a lot more. Don't go away.